within the womb is the safest place in the world. But we know through a study published in 2010 that there are over 247 chemicals in umbilical cord blood.
Everything, the solution is here's a pill for this, here's a pill for that. And they're missing the whole landscape of what makes a woman a woman.
As well as getting rid of estrogen or hormone disruptors. Drinking from a hot coffee cup with a plastic lid, drinking out of a plastic bottle, wearing sunglasses is a hormone disruptor.
Inflammation in somebody's body due to processed food, environmental toxins, stress, whatever it may be, and the role that plays in fertility in women.
Generational trauma affects our epigenetics, our genetic expression. Good news is,
I think this world is going to hell. I don't know what we're witnessing. I don't know if I want to bring a life into this world. Hi guys, welcome to another episode of Biohack-it. And I'm so excited to kickstart Women's Health Month, our second episode with Dr. Anna. And she is a board certified OBGYN, an integrative medicine expert. And I've been dying to meet a, integrative medicine expert OBGYN. So I'm so glad we got connected. You're also known as the girlfriend doctor because you make women easier to understand women's health and hormones, which is really important. You talk with two people, not at them, which is amazing. You also have 3 incredible books and your own personal story of reversing your menopause. So thank you for coming on to Biohack-it and working, teaching our community and talking to me.
Oh my goodness, it's great to be here with you and all of you here today. So thank you.
Thank you. So I want to kickstart right away with a big thing. When I took a poll and asked the community what they wanted to learn about, it was women's health and hormones, obviously. And a lot of women came to me asking about menopause and perimenopause. Yeah. So I wanted to hear more about your story and how did you reverse it?
Yeah. So I was diagnosed when I was only 39 years old with infertility and failed 6 rounds of the highest doses of injectable fertility meds. So it's devastating. It was completely devastating. And then after that was diagnosed with early menopause and told that the only chance that I could have of possibly conceiving was with egg donation. And that was devastating to me and my family. And it was a decision that we wanted to do at that time. So it literally took me on a journey around the world. I took a sabbatical from my medical practice and I left for a year. And in that journey, I learned so many different traditional healing foods and medicines and approaches and living completely different lifestyle outside of America. And as a result of that, and I say with the grace of God, that my menopause was reversed. I started cycling again and then naturally conceived the child I was told I would never be able to have when I was 41 years old. So really, and that empowered me. So I come back into my practice. It was in Southeast Georgia at the time. And I was fully on fire to teach this message, to teach this empowerment piece to women and families. And because we tend to get disempowered. And I say, it's like 99% is within our power. And I only say 1%, 1 to 10% is in my power as a physician because I'm still an egotistical physician. So I want to claim some credit. But the empowerment piece, when men are empowered in their health journey and they take ownership of this cathedral of our spirit, this temple of our spirit, but really a cathedral of our spirit that needs constant renovation, foundation, restoration, all of these pieces, then all those symptoms, all those syndromes tend to resolve very quickly.
And that's so fascinating to know. So what did you do? Where did you go? What was your personal protocol?
Yeah, well, it was very serendipitous. And I went in the US, I met with a Native American shaman and then went to Peru and met with a Andean philosopher that was it was really fascinating. In Peru, too, they say if you're infertile, drink maca. If you're tired, drink maca. Then they would elbow my husband and say, it's the Peruvian Viagra. So we were drinking some maca. Right? I couldn't stand the taste. So I was like, I'm going to choke this down no matter what. But then I realized, well, this is a superfood. This is this amazing adaptogen. The ancient Incan warriors used this food to give them stamina and energy and resilience when they went out into battle. And it's been used medicinally for thousands of years. What else is there? So I started combining other superfoods and, combining different ingredients and superfoods and using a very holistic approach to to help support our body naturally. So from Peru, went to South America and Brazil, and further in Brazil, and it was just an incredible experience. So I stayed on a coffee plantation in Brazil, got to pick coffee beans off of bushes, these red seeds, and it was red fruits actually, and then learned about the acerola cherry, and then other additional medicinal foods, and then from there went to Australia and New Zealand and spent time, listening to the philosophies and which is amazing. And then from there to Indonesia, where I met with an Indonesian healer. And something that was really profound, he said, we went to this Indonesian healer and I said, I'm infertile. And he said, no, it's not your ovaries. And he touched the top of my head and mine. And it was really tender, like this tender spot. I'm like, oh my gosh, what's going on? And he said, you worry too much. You worry too much, right? Chronic stress, fear, PTSD.
Fight or flight.
Right, fight or flight. I worry too much. And I don't have that soft spot, that tender spot there anymore, which is nice. So I must be doing better with that. And he said, it's not your ovaries. It's just that you worry too much. And then, from there, went to the Middle East and then Europe. I went a couple other places in Asia. And then, I found out I was pregnant.
That's amazing.
It was amazing.
And when you met any of the shamans, did you also go the plant medicine route and do any of those modalities as well?
At that time, I didn't.
Yeah.
I have since.
Yeah.
At that time, I didn't.
Because it's fascinating. We rely so much, and Western medicine is amazing. It's taught us so much, it's progressing, but we forget the ways of the ancient. Mm-hmm. And we forget how our ancestors have healed themselves and, healed ailments and gone back to their roots and understood that. And sometimes it's the going back is what helps you push forward.
Yeah. Well, we're organic beings, right? We're organic. We're not just physical beings. Mm-hmm. We're energetic beings, spiritual beings. And taking all that into consideration has been left out of modern medicine. I have one of my programs called Magic Menopause. I have a module in it with Dr. Soroka Sokic, and we talk about discovering your body's wisdom and blending traditional Chinese medicine with Ayurveda and acupuncture mm-hmm. to Western medicine, and the combination of emotions and organ systems and energetic pathways, and how those are critical to understanding where the disease is coming from.
And I think it's so amazing that, when you were diagnosed at the time with being infertile and being essentially essentially gone into menopause early, I think the fact that you turned to mindset, your spiritual body, yep. your food intake, what you were actually consuming, mm-hmm. and how you were treating yourself and talking to yourself, that later led to conception for you.
Yeah.
Is what's, I think, missing, because women from here are like, I'm trying to conceive, I'm not getting pregnant. They go to an IVF clinic or a fertility expert and they're like, well, you're not ovulating enough, you don't have enough follicles, you're not ready. And so they get so disheartened and they never talk about lifestyle. They don't talk about how are you sleeping? What are your stress levels? How does your cortisol? All those things that you spoke about impact fertility, especially for a woman. Mm-hmm. But yet we don't talk about that in Western medicine.
No. And honestly, if I hadn't lived it myself, and I wouldn't have, I wouldn't be talking about it either, probably mm-hmm. at this point. I mean, I was already in functional medicine, integrative medicine, and sexual medicine using bioidentical hormones since the 1990s. But it was like this whole reversal process that was mind-blowing to me. And it was interesting too, because using food as medicine, and in my books, mm-hmm. I create medicinal menus and talk about this to support our body's natural process. Because the, stress, trauma, natural aging has an effect on our ovarian function, and reviving the ovarian function is possible. Mm-hmm. So I finally went through menopause at 56. I'm 58 now, but there was another cycle where PTSD in my late 40s, 48, was really rearing its ugly head that took me even deeper into combining these techniques and physiology and really empowering our body's physiology.
And later on in the podcast, I'm going to talk about the PTSD portion, because we got to talk a little bit earlier this morning about your background and how trauma plays such a role in your fertility and in your genes. And I'm going to go into that. I want to also educate people. Women are like, in their 20s or 30s, they're like, well, what is menopause? What is perimenopause? What are signs and symptoms? Can we go a little bit into that?
Yeah. So perimenopause can be starting even in our 30s and early 40s. We can experience perimenopause. Technically, menopause is your day after 12 months with no period.
Okay.
But again, we reverse that so many times, and so many clients were like, I guess I'm not menopausal anymore, right? And so early menopause, perimenopause, the symptoms, like when you're experiencing the symptoms, it's not only a diminishing ovarian reserve, it's hormone disruptors, it's toxicity, it's stress. And if clients are experiencing PMS, that's hormone imbalance, right? PMS is hormone imbalance, and it worsens in perimenopause. Difficulty sleeping is often an early symptom. Waking up at 3 or 4 a.m. and headaches, certainly, especially around the time of your cycle. Anxiety, depression, mood swings, irritability. I remember a client said, I feel like there's a monster living in me and I never know when it's going to rear its ugly head. It's terrible. I'm like, okay, got you. And so with the gynecologic symptoms of irregular bleeding, breakthrough bleeding, shorter or longer than usual menstrual cycle duration, and stronger cramps, heavier periods, those are all some of the GYN symptoms that can be occurring alongside the what we call neuroendocrine symptoms. So the anxiety, the sleep disturbances, the brain fog, memory loss, all of those are part of perimenopause sequelae. And then the ones that aren't so common, restless leg, heart palpitations, crashing fatigue, waking without doing anything different.
Right.
That's very common.
What should be the cycle? So for example, I'm turning 41 this year. So my cycles used to be 5-6 days. Now they're 3 days, right? What should, for people listening, what should be the cycle? And you...
Well, it kind of it depends. From the first day of your period to when you start bleeding, everyone has a different duration. So for some, it could be every 22 days. One of my daughters is every 23 days, and another can be up to 40 days or in the 40s between cycles, but they usually have a regular rhythm. They usually are pretty regular. So knowing what's regular for you is important. When you start to see a change, you're like, okay, what's going on here? Maybe, I would say, okay, we need a good hormone detox. Maybe we need some adaptogens to support your ovarian function, support circulation. What do we need to do to, really optimize at this point?
And which adaptogens do you love?
Maca is my favorite.
Okay.
Yeah, maca, because that's when I really dug into in my journey, in my healing journey. And turmeric, quercetin, resveratrol, the chlorella and spirulina. I love adding those antioxidant detoxifiers. So I think those are really important. So those are key in the adaptogens. Something
that you said was really amazing, and I want women to understand this. PMS is not normal.
No.
PMS is a sign, and I listened to a panel 4 or 5 months ago as well, and a doctor said it on there as well. PMS is a sign of hormone dysregulation. It shouldn't just be acceptable.
No.
If you're having really heavy cramps or really bad pain or really heavy bleeding, it is not normal.
Yep. And I have my youngest daughter, she's 16 now, and she came to me a few months ago and she goes, Mom, I'm the only one of my friends that doesn't have problems with their period. I mean, I know when it's coming based on my app, but I don't feel any different. And I'm like, I know when your period's coming and you're not been healthy, and I'm giving you some more of my medicinal meals and some making sure you drink mighty maca before you go out the door.
That's amazing. She's, she probably takes it for granted because she's your daughter and she's like, whatever, this is my norm.
Right.
Versus having you as a guide, which is amazing.
Yeah.
Versus her being out in the world by herself.
Totally. I'm like, here's your power smoothie, honey.
Yeah. I wanted to talk to you also because you're board certified OBGYN.
Yeah.
And we just spoke about, there was an article that came out in the Washington Post talking about women are getting off birth control because of medical gaslighting. But they're saying you're getting off the pill, because of misinformation.
Yeah.
When I think that's actually medical gaslighting.
Yeah, I think that everyone needed to be on the birth control pill to begin with is medical gaslighting. So we know the progestins, and there have been, the research is consistent that progestins have negative cardiovascular and hormonal toxic side effects. We have to be on the birth control pill for a certain amount of time for birth control. I mean, there's a reason, right? I prefer the non-hormonal IUD and non-hormonal birth control, and really, getting in tune with our bodies and not adding in what is a known hormone disruptor. And especially in perimenopause and menopause, people being put on birth control pill, even though they've had a tubal ligation or their partner has a vasectomy. Here, let me just manage your symptoms with, and it's not giving them the bioidentical progesterone that's really starting to decline in our mid to late 30s. That's neuroprotective. And so all these other neuroendocrine symptoms continue to come up or worsen because of the hormone disruptors in birth control pills. And that adds to other problems.
And the lack of progesterone is actually what causes the anxiety and the depression and these drastic mood swings in women. And they're like, I don't even feel like myself, but is this normal? And then they go through society thinking it's normal, but it's not. And that's where the medical gaslighting comes in so much. I was just shocked to see an article like this in a credible newspaper saying, hey, your women are getting off the pill because of misinformation, when it's medical gaslighting. To say that, to tell a woman your signs and symptoms aren't valid.
Right.
When they are the demo and the person who is the one consuming the product.
Right. Exactly. And I think that's a very sad state of society. And one thing I tell women is menopause is natural and mandatory. Suffering is optional.
Yes. And how you go through it and how you approach it.
Yes. As an empowerment piece versus you need this, that, and the other thing.
And I think that what you do really well in your practice, is you empower women to know that their health can be in their hands, and they don't always have to look outwards, but they can also look inwards if they get the proper tools and the proper research and know what to do with it.
And giving your body the time it needs to rest and restore and rejuvenate. I mean, that's powerful.
It's really, really beautiful to see that, because a lot of practitioners nowadays, because it's more effective to them to make that money, want to keep on making you feel like you need to go back to them versus letting you heal, teach you, and setting you off into the world.
And I think it's because, it's just not in their doctor's bag. It's not taught in universities, and it's not taught in our residency programs. And again, the way practice is, and I've been in conventional practice. I mean, I remember seeing 50 patients a day. And how can you see? Now I see 4 patients a day, right?
Right.
So it's, how well can you take care of that patient? And it's that thing, okay, let me just treat the symptom, because that's how I'm taught. That's what's in my doctor's bag. Let me treat the symptom, and, I'll see you for follow-up, and then we'll treat another symptom or side effect of what I've given you to treat the symptom. I mean, it sounds crass, but honestly, that's a lot of the practice versus, okay, let's empower you. And this is also in the patient's responsibility field too. You need to know that you have power over your body. So you need to take that responsibility, making the right choices, prioritizing ourselves. And as a mom, as now a single mom for over a decade, understanding that in order for my family to be well, I have to be well. I can't get everyone well and expect that I'm going to be well. They're not going to get well unless I'm well. And so it is a very powerful position in a family to have.
And I think talking about the root cause as well, because everyone's root cause can be a little bit different. Why you're having a dysregulation in your hormones, or why you're going into early menopause, perimenopause, all of that stuff. So getting to the root cause of what's going on in your body is really, really important, versus doing like a Band-Aid solution for it, not looking at that, putting somebody on the pill and not understanding, let me go a step deeper and understand what the root cause of this is.
Yeah. And I think it's really important, especially now. I want to give an example of a patient. And she is a 34-year-old patient who had a normal pregnancy. The pandemic hit. She went through standard of care, injections, et cetera, had been infected with COVID once. And then during that time, she had a pregnancy that ended tragically in a trisomy. And then after that, she had a chemical pregnancy and went to the best fertility doctors. And her AMH was 0. It was 0. So she had no ovarian reserve, no ovarian function. Okay. They diagnosed her with early menopause and said, you're not even an IVF candidate. Just, that's it. And she was devastated. And she found me and came to me. And, I started working on a hormone detox protocol. It's kind of core, follow my hormone detox plan, follow these recipes, work with these adaptogens and detoxifiers, and naturally supporting her body's circulatory system, foods and nutrients that increase nitric oxide, and also working with her ovarian function. So just with this combination, in 2 months, her AMH was, close to 1. And then in 4 months, I told her no trying for pregnancy for 4 months, let me retest you. And she came back in for a 4-month visit. 8 weeks pregnant. She's now 13 weeks pregnant, and I'm really, really happy. Everything is, thank you, God, very healthy.
That's the main touch wood.
Yeah,
I would hear, but that's incredible.
Yeah. So she had been given, and this is why I like to tell clients, your diagnosis is not your destiny. Your prescription is not your description. And that's the empowerment piece. I want everyone to hear that, because I had that same, look, there's no chance diagnosis.
Right.
She was given, this many decades later, almost 16 years later, that same, sorry, there's no chance. And I love proving that wrong.
We wouldn't have a podcast talking about optimizing women's health without talking about BodyBio. I use BodyBio every single day, and their hero product is a necessity for everyone in my house. PC is a pure liposomal phospholipid complex that helps protect the 70 trillion cells in our body from aging, environmental stressors, and toxin exposure. This little guy is great for everyone, you, your husband, your kids, and even your pets. Our health truly starts with ourselves, and PC gives them the support and maintenance they need. To learn more about BodyBio, head over to their website, www.bodybio.com, and use the code Biohack-it for 20% off your first order. And if you've already purchased BodyBio and want to rebuy, use Iman at checkout for 15% off all your orders.
And do you think it's a lot to do with also inflammation that women have in their bodies? So we talk about the role and the correlation from a medical perspective of inflammation in somebody's body due to processed food, environmental toxins, stress, whatever it may be, and the role that plays in fertility in women?
Yes. Yeah. So inflammation, when I look at when I look at optimizing someone's health, there are 3 key things that I want to address that I call the devil's pitchfork.
Mm-hmm.
So it's hormone imbalance issues, whatever those causes are, inflammation, because it's a huge activator, and adrenal dysregulation. Adrenal dysregulation from stress, chronic stress, everyday stress, adverse childhood experiences, and just, living in today's modern world, right? There's so many stress, work stress, kid stress, relational stress. So
and the stress of not being able to conceive. Like when a woman really wants to have a child and you tell somebody, hey, you've gone into menopause, you can't conceive, what goes through that woman emotionally, because sometimes women feel like they're failures, sometimes they feel like they're letting their partners down, sometimes they feel they're inadequate. So to do that to somebody, and for them to carry that is also a stress.
It's a huge stress, and it creates a lot of discord within relationships. I mean, couples that have dealt with infertility have a higher rate of divorce. I think that's really important to understand. Just that sense also, my body's betrayed me. And now I don't feel at home in this body. And that's a real phenomenon. So to get yourself in love with your body again, empowered within your body, energetically aligned within your body, is that in of itself is healing.
Right. That's huge. Can we also tell everybody a little bit about what are bioidentical hormones and hormone replacement therapy?
Yeah. So this is a lovely area. Bioidentical, we've been using that term for a long time. And now you'll hear body identical. So some pharma companies will say body identical. What does that mean? It's basically bioidentical. So body identical or bioidentical is like the identical to the hormone our body produces naturally. So estradiol, there's many conventional forms of estradiol that are body identical or bioidentical. And so, and then progesterone is a bioidentical. Progestins are synthetic and look nothing like what our body produces naturally, and don't act within our body the same way. And so, with diabetes, we've always been giving bioidentical insulin. With thyroid, we've been giving bioidentical thyroid, for the most part. And so thinking of, that why that would be thought less optimal just baffles me.
It's crazy. And why do you think that's not coming up more in conversation, to be like, hey, we need to give bioidentical? So if you're doing it for thyroid, you're doing it for diabetes, why aren't you doing it for the biggest thing, women's hormones?
Right. Yeah. I don't know.
And do you think a lot, so I have in the last, I lived in Miami for 10 years. I've had some really bad experiences with OBGYNs. I've been, I'm so glad I met you now, because one I've been to, and I was like, hey, I used to have ovarian cysts when I was younger. They're like, why are you not on the pill? I was like, because I don't feel well on the pill, and I'm navigating through I don't have cysts anymore. And to prevent pregnancy, I'm actually on, an app called Natural Cycles, and I monitor where I'm in my cycle. But I felt like they were so aggressive with pushing the pill down my throat. And then I've had other friends who've gone and they'd be like, oh, well, you should go on to these hormones, without really looking at them as a full person, what's going on in their body, what do they really need versus going straight to here's hormone replacement therapy.
Right. There's so many issues with that I have too. And I think it's all, again, what is in their doctor's bag? This is what they know. Now, what do I know? If I have a client with ovarian cyst, I know that iodine, GLA, those are a couple supplements that I want to optimize. I want to look, why is her body forming cyst anyway? What's going on with the detoxification pathways? Where can I support her natural rhythms? And so often that just from breast cyst to uterine cyst or cervical cyst, our ovarian cyst, and we can really resolve those very well and very easily. And then the concept of, okay, again, we don't know what we don't know, but being able to reverse the changes from those common three, adrenal dysregulation, inflammation, and hormone imbalance, just goes a tremendous way. And I wrote in my first book, which is The Hormone Fix. So it takes more than hormones to fix your hormones.
Absolutely. It's a lifestyle.
It is.
It's a lifestyle. It's your nutrition. It's how you're talking to yourself and treating yourself. It's your sleep, hydrate. It's the basics almost that people forget because we're so busy and neurotic in this world, and living here has made us so hectic that we forget about the basics.
Yeah. And also there's been some amount of conditioning that, you need a pill for that.
Correct.
And that's not necessarily true.
You talked about something right now, and you touched upon something, what people have in their doctor's bags. So this is where I was so interested to talk to you and how you're, treating and working with clients and patients versus a lot of OBGYNs out there just like trying to use typical pharma. They don't want to dive deeper. They're not looking at holistic ways at all. Everything, the solution is here's a pill for this, here's a pill for that. And they're missing the whole landscape of what makes a woman a woman.
Yeah, I think because initially in my training, so I went to med school over 30 something years ago now, that it was, you had your schools of camp. Like I went to an osteopathic, so we were more holistic versus an allopathic and versus very holistic, which is naturopathic. And so I think now, because of additional education, I'm here educating physicians of all specialties now, and have been for the last 15 years with the concept of, okay, we're starting to integrate more. We're starting to work together. We're starting to see in our families where that modality isn't acceptable. Like we have to find a better answer. And today I had spoken this morning and lectured, and a guy one of the physicians came up to me and he's like, I just wish my wife was here to hear you. It's like so empowering. He says, everyone you're speaking to, I bet you they're thinking of themselves or someone they love that would benefit from this information. It's just not something that's taught unless you seek it. And when you're a busy physician, especially OBGYN, it's hard to get that outside information, but yet now it's available.
And it's also them wanting to see how they want to better their patient's health versus what's going to make them the most money.
Yeah. And this is something I learned.
It's more morality, I would say, essentially. It's like,
And physicians, for the most part, especially OBGYN, I think we're the loveliest, especially in my opinion, a little biased. But, we go in, as physicians, we go in wanting to help and heal people. And we think what we're getting is going to help. And then when we realize we're just pimps for big pharma, maybe, then it's a betrayal. And to layer off that indoctrination that we've had is very, very challenging for some.
Yeah.
Very challenging. There's always there's always a better way. Yeah.
So somebody can come work with you from preconception all the way up to their last trimester, and you can coach someone through it all, right? So if somebody contacts you and says, "Hey, I'm going to come to you. I'm not being able to conceive," and then you can help them through the whole course.
I can support them. Now they'll see their OB,
of course,
OBGYN, and like my other client will see each other, check in with each other every 6 weeks, and
that's
monitor
amazing.
That to optimize her health, because again, we don't want anything. They have to heal the gut to heal the hormones, right? So, and she had such a big gut disruption too, chronic stress and the inflammation. And so working, so it's like a persistent, it's a collaboration. I like to collaborate with my clients in order to support their optimization.
Because also in every stage of the pregnancy, you need different things, right? To help the baby grow better and feel supported, the mother and the child's health?
Well, in general, the baby, like within the womb, is the safest place in the world, right? Within the womb is the safest place.
Yeah.
But we know through a study published in 2010 that there are over 247 chemicals in umbilical cord blood. And if we start thinking as early as possible, we want to conceive, detoxing, decreasing our exposure to endocrine disruptors, plastics, the stuff in our cosmetics, dish detergent, etc. We start doing that earlier. That's powerful.
Yeah.
Yep.
You also discussed something about the hormonal hierarchy. And the question is oxytocin really the most powerful hormone?
It absolutely is. It absolutely is. And I always think, okay, how can I get more oxytocin into this person's life? And I like to say that within our body, we have the most amazing pharmacy. We have a better pharmacy than any corner pharmacy or anything. It's an amazing pharmacy. So we produce oxytocin, the hormone of love and connection and bonding, but it's also an immune supportive hormone. It's a regenerative hormone. It has so many benefits, and then we produce it ourselves. And so getting into practices where we start to make more oxytocin, we really focus on that. It makes everything else better, everything else fall into place.
And what are some of the tools or resources you tell people to create more of that oxytocin in their life and in their body?
Yeah, the first thing is really starting with a gratitude practice. So I have a gratitude practice that, before I even open my eyes in the morning, I do this practice. I think, where did I see love yesterday? Where was I loving? And the second question I ask myself is, what am I grateful for?
Right.
And no matter what, and I've been into the depths of despair to, after my own personal trauma, suicidal, deep depression. So I know that can be hard, but this is a practice that, I wouldn't be here without it, I'm telling you. So what am I grateful for? There's always something to be grateful for. I'm grateful for this bed. I'm grateful for the clothes I have to wear today. I'm just grateful for my family. And you just focus on
the small things, because the small things are the big things.
In the present moment, what you're grateful for. And then, where could I have laughed at myself more? Where did I laugh yesterday, or what was funny? And laughter increases oxytocin. So playing with a pet, watching funny movies, calling your, sweet friend that always makes you laugh. And, those are things that...
moment of connection.
Yeah, connection, intimacy, orgasm, sexual play, pleasure that feels good, massage, head rubs, playgrounds, like swinging on a swing in a playground increases oxytocin.
Bringing more fun into your life,
exactly.
Bringing more play into your life,
in the present moment, right? And that just being able to schedule that in. I have a patient that's in her mid-40s, and she was dealing with anxiety and depression, was on, a few different medications, and I worked with her the same regimen, always hormonal detox, adaptogen, support in that way. And I said, okay, you've got to choose something fun to do and start, like, what are you doing for fun? And she's like, I'm just barely getting through the day. And so she came back to me and she was really like another person. Her energy was light. She was smiling. And I'm like, okay, so tell me what you've been up to. She goes, I took your advice and I wanted to do oxyplay. I call it oxyplay. And she said, I started taking dance lessons. So now I go 2-3 days a week. Amazing. And I'm just dancing again. And she loved dancing.
That's beautiful.
Isn't that beautiful? And it was like, okay, you're making more oxytocin, doing something you enjoy, no prescription needed at this point. And she's been able to come off all our anti-anxiety meds.
That's amazing. Sometimes it's just looking at what's right in front of you, and rather than being like overwhelmed, being like, how am I going to figure this out? And just looking at the little details that make you happy and how to amplify those. I also want to talk about the roles of the different hormones. So for people listening, if they're young women listening to this and they're like, well, can you walk us through, Dr. Anna, with all the estrogen, testosterone, cortisol? I wanted to talk a little bit about each hormone.
Okay. So when we think about in our mid-20s, we have our DHEA levels start to decline. I like to differentiate. DHA is omega-3. DHEA is an adrenal hormone. So in our 20s, we really want to start focusing on optimizing our adrenals, getting into a gratitude practice, getting our rest and rejuvenation and supplementation to help support our adrenal glands. And again, especially everything we have to do has to decrease inflammation. So we want to stay anti-inflammatory. For me, it's high quality protein, healthy fats, lots of alkalinizing greens, and supportive food for digestion and gut health. So in your 20s, you really want to focus on that hormone, because from DHEA we make estrogen and testosterone.
Right.
And then in our 30s, progesterone is really like the hormone that starts to dip off.
Right.
And that's when we see this progesterone insufficiency symptoms, sometimes called estrogen dominant symptoms. And so we want to make more progesterone. So here again, progesterone is reduced by stress. When we are making cortisol, it comes from progesterone. So we will steal progesterone to make cortisol. So here, even more importantly, to set your circadian rhythm, make sure you're focusing on good sleep, you're getting out in nature, you're supporting your stress response, meditation, prayer practice, good friends, good community helps reduce that high cortisol. So now you're going to maintain and support progesterone, as well as getting rid of estrogen or hormone disruptors. So we call them estrogen mimickers or hormone disruptors, and there's so many. The plastics, drinking from a hot coffee cup with a plastic lid, drinking out of a plastic bottle, wearing sunglasses is a hormone disruptor, y'all. Don't get on me for that, but vitamin D is synthesized through our retina. So that, and we make melatonin through that circadian signaling. So optimizing that really supports our hormones. And then estrogen and testosterone. Again, further on. So with estrogen, it is the hormone of femininity. It gives us our curves, a weight around the hips. Cortisol gives us belly fat and fat around our chest and shoulders. So estrogen is, will naturally decline as we age, but optimizing the precursor hormones and removing things that are disrupting receptor sites and making sure we've got healthy amounts of vitamin D on board and iodine, because iodine's part of every hormone receptor, including thyroid. So that will help our bodies, use estrogen in a healthier way. And then testosterone, it's definitely a female hormone. Guys make 10 times as much testosterone as
we still need it.
As we do, as women, but we definitely still need it. And it helps us build muscle, keep the bones strong. And so high intensity exercises, good night's sleep, weight bearing exercises all help to keep testosterone healthy.
Obviously, you all know I'm a biohacking fanatic and I absolutely love peptides. So you can only understand how excited I was when I discovered a skincare brand that works, that uses peptides. That is OneSkin. OneSkin uses the amazing OS1 peptide. OS1 works by actually switching off the senescent cells that drive the aging of your skin. Scientifically proven to give you biologically younger skin with long-lasting improvements in firmness, elasticity, reduction of fine lines and wrinkles, and a more youthful complexion. You can learn more about the OS1 peptide at oneskin.co and use my code Biohack-it for 15% off your purchase.
And what about obviously the liver produces a lot of hormones, right? So liver, gallbladder, kidneys, all of that stuff. So women here are listening, being like, hey, should I look into that? How do we test for that?
So with hormone testing, so in looking at, that's why, liver detox and liver support's important for hormone metabolism and also the ability for our bodies to use those hormones better. So in looking at testing, there's a few different ways to test, and it depends on where in your cycle you are when we're testing. So we usually will test in menstruating women around cycle day 2 or 3.
Okay.
And we look at baseline FSH, LH, estradiol. And if we want fertility, we're going to look at the AMH, which is the anti-Mullerian hormone. And this gives us an image of ovarian reserves. And day 21 in our cycle, or at least around a week after ovulation, depending on your cycle length, was typically around at day 20 to 22 or 24. We look at peak levels of hormones, so progesterone. How is your testosterone during that time, and estrogen at that way too, but definitely progesterone. And DHEA can be checked at any time. Thyroid hormones and thyroid antibodies are critically important. So I have a young 29-year-old patient. And she's lovely. And she had been dealing with infertility for 3 years. She'd been to her primary care doctors. And so she came to see me. She wasn't getting anywhere. 3 years, no birth control, no anything, and no pregnancy. And so I did her full labs. And if you had just looked at a short thyroid panel, she's 29. So her TSH, even free T4 and free T3 were in the optimal
Right.
But her reverse T3 was really high, and her thyroid antibodies were the highest I've seen, off the charts. The lab read them as greater than. So off the charts. So she's in complete thyroid storm. And also her fasting glucose was good, but her fasting insulin was in the 20s, and it should be 6 or less. And she's completely insulin resistant, and her hemoglobin A1C is in the pre-diabetic range. And so
Wow.
these, we can make a lot of movement here. And else, when working with a client, I don't know if they're gonna get pregnant or not, but I'm gonna create a body that's healthy and optimal and a great host. So that's, in working with her, that's what we're doing. But things are missed. So you've got to look at these laboratory values.
And what was going on in her? Was something going on in her life, or was it her lifestyle? Was it her lifestyle choices? Like, where did you pinpoint that?
Well, there's one thing. She is a chef for
Okay.
the school system.
Okay.
And she has to make these. She says, we don't get to choose what we make. I'm like, make these keto green recipes.
Yeah.
And she's like, oh no, I think we did fried chicken the other day. I said, can you make healthier versions? And she's like, no, we did mac and cheese the other day. And she's like, I'm working these 12-hour days, and so I'm eating what I'm cooking.
Whatever. Yeah.
I said, well, it's not
That's not
negotiable
what you're-
anymore.
yeah.
And the other thing is she had adverse childhood experiences. So she had significant trauma as a young child. And so that's another piece of her therapeutic regimen that she's working on, because it does make a difference.
So I'm so glad we because I went to start working through trauma. So I want to talk about childhood traumas, whether we remember them or suppress them, the role childhood trauma itself can play when it comes to conception.
Yeah, and it is significant. So what we've seen in childhood trauma and post-traumatic stress, there's very similarities. But I also know that, according to research, if we've had adverse childhood experiences or PTSD, we have a worse time in menopause. And I really had to dig into this. Why is that? What's going on there? Chronically, with adverse childhood experience and trauma, there's lower oxytocin levels. So that's one thing. And also in perimenopause, when progesterone levels are declining, I like to consider progesterone the lid of our pressure cooker. And so you lose that progesterone, the lid of the pressure cooker of your life comes off, and there's not that neuroprotection, because progesterone is so neuroprotected, with or without a uterus. It is neuroprotective. And so there's those aspects there. Plus, with chronic cortisol, adverse childhood experience causing the stress state, this hypervigilance, and I experienced tremendous PTSD. I was sleeping for 3 hours a night for years and constantly hypervigilant, protecting my kids, protecting my family, all of these. It was very interesting to look back and see everything I was living with. But it leads to high persistent cortisol, which is going to raise your blood sugar, which is going to create insulin resistance.
So I want to talk a little bit more about your background and talk about the PTSD. So when I was doing research on you, I was so excited to hear that you are a Palestinian Christian originally. So I want to tell everybody a little bit about your background, your childhood, and the role that generational trauma causes on a cellular level that then impacts women. We don't even know it. That's impacting generations upon generations. And the programming.
Yeah, and then it's and thank you for acknowledging that. So I appreciate it. It's a very difficult time now. Certainly, I've been triggered and working to think, okay, well, from the trauma perspective and my mom's trauma, growing up in a war-torn area, losing her, loved ones, losing her home, and how that may have affected her in her life and how she handled that. Now, the interesting pieces from my family culture, it's a tremendous amount of faith and humor and gratitude and presence and focusing on what we like, not what we don't like.
And resilience.
And resilience, right? That builds that resilience. So I didn't hear, like, from my mom or from my family, there was no criticism. There was no, certainly no hate. My house was like international, I call it the United Nations, the United Nations growing up. But it was that in the present moment appreciation. Family is important. Your friend family is really important, that you have each other's back. And community, we know, is one of the blue zone characteristics for longevity. And so those are things that I grew up with, but she also became diabetic younger than her siblings, and heart disease, and she died early with heart disease. So inflammation, hormone imbalance, and adrenal dysregulation. So all come into play from that activation of those, survival mechanisms in so many ways.
And what we're seeing going around in the world right now, whether you're Arab Christian or you're Muslim or you're Jewish, just even from afar, leave alone the people who are actually living it and breathing it day to day, right? The trauma that our generation of women is experiencing by just partaking in viewing the world. What impact do you think that's going to have on our health and hormones? And also fear of procreation. Yeah. I can tell you about that. I was like, I think this world is going to hell. I don't know what we're witnessing. I don't know if I want to bring a life into this world.
Yeah. Yeah. And it's honest to think that way. And it's and to voice that, because that's powerful, because that's part of healing,
right?
Is showing up as our authentic self and being able to speak about those. And then trusting, you have to okay, who can I trust right now?
Yeah.
And so we lean into our faith, we lean into each other. And I think that's really important to stay. However, when we have such trauma, we have a tendency to isolate. I know I certainly was in this isolation phase. My cortisol was off the charts. I wasn't sleeping again. I really honed in on my sleep hygiene. So wasn't sleeping again and all of that, but yet also thinking I have 4 daughters. So how am I living by example for them? What are we doing together? How can we help? How can we, in the Bible, it says, give of your time, your talents, and your tithes. So, so how can we support? What can we do? How can we help? How can we show up in a positive way, in a positive light? And it's challenging. It's really challenging. And the generational trauma is, we were talking about Gabor Mate, and I love how he talks about it too. It's the generational trauma affects our epigenetics, our genetic expression. And so, but good news is, again, if our environment has an effect on our genes, we can manipulate, to the best part, our environment as much as possible. Yeah. And the practices, and I've traveled around the world as part of my healing journey, and I call travel my meditation. I just love to witness other cultures. But our longest standing cultures, like the Arabs, like in India, the practices are all around family. I mean, you celebrate a wedding for a week. You celebrate every birthday, anniversary,
everything, good or the bad.
I mean, name it. There's things to celebrate, and you come together to do it. And I think that again increases oxytocin. Absolutely. So the habits that they've created in their lives between faith, fasting, community events, celebrating is a counteract, is a big.
It's a huge thing. Yeah. So in the West, I've noticed that we have very nucleus, kind of it's me and my immediate family. That's all anybody cares about. But part of the world that we're from, it's about our entire family. Okay. And, I'm South Asian, I'm Pakistani, and, my in-laws come and stay with us for 3, 4, 5 months. Eventually the goal is that they move in with us. Eventually, my other friends are sitting there going that doesn't overwhelm you? Why would you? And I was no, for culturally, that's part of our culture. They are my family. And so for us, it's very normal to have this extension to ourselves, which gives us joy and reassurance and just brings love into our life.
Oh my gosh, it's magnetic. Yeah. Right? It's magnetic. It's so therapeutic. And it's so true. I've definitely witnessed that too. And so for us, where there's family, there's flora. We have space for you.
Exactly. And we'll make the adjustments. Yeah. And it's this idea of opening yourself up. And I think that, having seen what the world is kind of going through, makes us feel scared and alienated and rises our cortisol levels. But also, we're not talking enough about the generational piece of how it's affecting us.
Yeah. And then being honest and authentic and being able to have a conversation, say with people of opposing views or views. I mean, this is where I'm coming from, without any prejudice. This is where I'm coming from. These are my experiences where, what makes the world a better place. And what we know is we are, as energetic beings, we are all connected. Yeah. And so if we think about that as this connected force, what we can do together is healing energy. It's not based on race, color, area of the world, religion, etc. we're all connected. And I think remembering that piece, but also showing up authentically and being able to speak up first
And give our voice,
and give our voice.
and not be gaslit for that. So, when I was researching and looking into some of your work, and, you were heavily attacked for just wanting to promote peace and stop killing. And it wasn't for one side or another. You just didn't want to be witnessing what you're witnessing for either side to suffer. And people really attacked you and got nasty. And it was really like, I was reading through some of the stuff and I was like, wow, like people really online feel they can say what they want, do what they want. They hide behind their screens. They get petty and they don't understand the repercussions of what they're saying to the other person.
Well, and you think, this is when I read through that thread, because I have family in Palestine and Israel, and they're living all of this now. And so this concept of, well, what did this person who wrote that really was horrifying. And this person who wrote that, what has she been through that she's become this type of person?
Correct.
Or how did she become this kind of person? Or how has she had to justify things in her life to become this kind of person? So I have a tremendous amount of sympathy for that person.
Absolutely.
I don't want to meet them, but I'm sympathetic.
What's so beautiful is I have a friends on both sides. I have a lot of Israeli friends. I have a lot of Arab friends and Arab Christian friends. And the beautiful thing is, for people who really are from that part of the world and have lived it and their family's gone through serious trauma and stuff, they still have so much love to give.
So much love.
They're not the hateful ones. They're not discriminating. There is space in their heart still for everybody. And I think that's a beautiful thing. And I have a lot of dear Palestinian friends who have so much still love and respect for, listen, this isn't us versus you.
Right.
And that's what the narrative people want to get told. And when I speak to my Palestinian friends, that's not what they're saying.
Right. Right. And I think that, because you've been in it for a long time, we know that there are, there are bigger agendas at play.
Absolutely.
And so the concept, how these cultures have survived is through the faith, the community, the love, the giving, the helping. Like, okay, this is my last piece of bread. I'm going to give you half, or here, take the whole piece. And I think that shows a tremendous amount of spiritual growth and compassion that is incredibly healing. And so seeing that, and not judging someone based on,
their ethnic background, religion, or having a difference in opinion. We have forgotten the space for debate, and we've forgotten that everybody comes from their own experience of what they're being exposed to or trained or thought. And the only way you will eventually influence anybody to even understand your perspective is by explaining it to them. They may not get it right away, but over time, they may be able to relate to you. And if they don't, that's also okay.
That's okay, right? And also my mom, who's Palestinian, was Palestinian Christian and was born in Haifa. And what she would tell me, she said, Anna, one of your best education is travel.
Yeah.
From there, you learn that everyone's the same, right? They're not so different from you. They love their children the same. They, take care of each other. So pay attention and learn the languages, because the languages will tell you a lot about a culture.
Yeah.
And so the Arab culture itself has 100 ways to welcome someone and greet someone. And I love that hospitality.
It's beautiful. Yeah. This brings me to, I'm doing a closing tradition on the podcast. And you have been such a wealth of knowledge, and just connecting with you on the car ride here to now, there's so much you've shared that's been so beautiful. So my closing tradition is, what is the one lesson or learning to date that has been most impactful and has carried you throughout your journey?
One lesson that I've learned. And I think, the message that I've given is never give up. I always say there's hope. Where there's hope, there's a solution. Right? You can make it happen, to always have hope. And then the most powerful hormone is oxytocin, doing life with love, giving your time like
That's
you
beautiful.
are here, giving your energy, giving of yourselves, and loving yourself. My perfect perfection, my perfect imperfections, right?
Your flaws are what make you beautiful. And I don't think we need to be striving for perfection. And just to hear your story and how not only have you healed yourself, but healed so many women and helped them get a better handle of their emotions and their health and their fertility and their ability to create life is just really, really beautiful. Thank you for doing this with me. I'm so excited I got to meet you and chat to you and get to know you more.
Oh, me too.